Good afternoon. As you've heard, I'm the Chief Executive of Self-Management UK, which is a charity and the country's leading provider of self-management programs for people with long-term conditions. And in common with over 70% of our staff and volunteers here, I too have many years sharp-end experience of self-management, in my case of various autoimmune conditions. So I'm absolutely delighted to be here and to present the business case for self-management from a patient as well as a system perspective. Those of you who took part in the previous webinar on self-management will have heard some of this information before, but slanted much more at that point from a patient perspective. This time, what I want to focus on more is on the business case for self-management and making that business case within a commissioning environment. So in more detail, I'm planning to cover the following. Sorry, I don't seem to be able to move on to my next slide. Here we are. The technology is working, so that's great stuff. So I'm just going to tell you a little bit about Self-Management UK and what we are and what we do. Just talk very briefly about the evidence-based benefits to patients. Then go on to talk about how self-management can deliver savings to the NHS. What in a particular CCG area the return on investment can be, and then to focus more in detail on how to actually make the business case for self-management, and I'm going to use a case study there as well. And then obviously I'm happy to answer any questions or take part in the further discussion as you wish. So for those of you who don't know us, Self-Management UK is a national charity, as I said earlier, that provides self-management programs for people with long-term health conditions. We've got over 12 years experience of working within and latterly for the NHS. We've got rather an interesting history, if a bit convoluted. The organisation was originally hosted within the Department of Health, who in 2002 decided to introduce the concept of self-management to this country using a generic model that had been developed in the United States. In this country, it became known as the Expert Patients Programme. Then in 2007, the organisation was outsourced from the Department of Health to the Expert Patients Programme Community Interest Company. Now at that time, the Community Interest Company structure was a new, and it has to be said, untested vehicle for social enterprises. And so over the course of time since then, we've been looking at the operation of the CIC, the Community Interest Company, and the conclusion that we came to was that because of various funding and also tax issues, that we should set up an associate charity, which we did in 2012, and that's been running in parallel to the CIC over a period. And again, because of those funding and tax advantages, we decided ultimately that we should move the activity from the CIC into the charity, and I'm really pleased to be able to say that as of the 1st of June this year, we actually managed to do that. So all of the activity that was previously in the CIC is now in the charity. Some other information that I think is relevant is that when the organisation was first set up, it was designed to deliver the Expert Patients Programme only under licence to Stanford University in the States. Since then, we've moved on considerably, and over the past few years we've developed our own services, improved our offering for both patients and commissioners. Not only that, but we now work closely with practicing clinicians, healthcare professionals and students, as well as patients themselves. And while we've exceeded in terms of the original objectives of our set-up grant from the Department of Health in helping well over 100,000 patients with long-term conditions access programs, that's really just scratching the surface. And our vision is one where self-management is, as Bev said earlier, not seen as just a fluffy add-on, but a must-have support for everybody, available to everybody who's been diagnosed with a long-term health condition. So I just want to touch briefly on the benefits to patients, which explains partly why it should be a must-have approach. There's a whole list of benefits here. I'm not going to go through them all in massive detail, but I think there's definitely evidence out there to show that physical symptoms improve, clinical outcomes can also improve. We know from our own research and from other research that patients' quality of life is better. We know that people discovered that their self-esteem and self-confidence soar after our programs. And people also tend to understand how to get the most out of their interactions with the healthcare system, and also to relate better to their own family and friends and community. And I've certainly experienced those life-changing benefits by attending self-management programs. But there is evidence also of significant benefits to the healthcare system as well as to individuals. Now, this table shows some of the potential reductions in system usage if people have been through self-management programs. And what we've done is to take this evidence of better system usage and put that into a model which can be used in each and every clinical commissioning group area to demonstrate the benefits to the system there. So the tool that we've developed is essentially a financial model that allows commissioners to look at what the benefits might be in their particular area, and to also enable them to target those patients who are most likely to benefit from self-management interventions and support. The tool doesn't use our data. It uses data that has been derived from the Department of Health and other studies to calculate the financial impact and demonstrate the financial benefits. So in a bit more detail, how do we take those assumptions through in the model? Well, we look at the reductions in system usage that I mentioned earlier, and we've also got data, again, not our data, the data from the Department of Health, on the typical costs of NHS-type services. And what we do is apply the percentage reductions, work out the financial impact of those reductions in usage, and thus we're able to calculate a return on investment for commissioning self-management programs. So if I could perhaps take you through a case study. This is actually based on a CCG in the east of England. And if you see there that particular CCG has a population of over 60,000 people living with long-term conditions. And you can see that the burden of system usage related to that is enormous. And hence the associated costs. In this particular CCG, you're looking at over 300,000 GP consultations, a huge number of A&E visits, and as we all know, we've seen the news over the last few days, that's a key priority for the NHS to try and reduce. And also total medication spend there approaching £28 million. Now, for that particular CCG, we calculate that for every £1 spent on investment in self-management programs, the CCG can actually save £2.24. Now, in other CCGs, the return will differ clearly, but that is quite a significant potential return. And we base that on just looking at an example, not putting every single person with a long-term condition through a program, but looking at putting a fairly small number of people with long-term conditions through the program, and we can see even just putting a percentage through, savings there, gross savings could exceed a couple of £100,000. Now, clearly the cost of the programs has to be taken off that gross saving, but even then there's a significant saving, and that relates back to the figures I mentioned earlier. There's also an interesting study that was done in Kingston, which shows that the potential benefits could be even higher. This is not a study that we were involved in, but it does show that for this particular CCG area and this particular study, that there would be very significant reduction in system usage and hence potential savings after people have gone through self-management sort of programs. I mean, I think it's important to say we've done some calculations, not just at an individual CCG level, but looking at what might be the potential savings across England if just a percentage of people, say 10% of people with long-term conditions, were actually offered the opportunity to go through programs. And we estimate, and this depends on the basis of the calculation, that the savings could be between £1 and £2 billion. Very significant numbers, whichever way you look at it. But I think the important thing is, in order to achieve those savings, that within individual commissioning areas, there has to be a really robust business case made, and I think that's becoming increasingly the situation, and certainly in CCG areas that I'm involved with, I know that the focus is very much on getting value for money out of any investment and any commissioning decision. So these are what we think are the key elements of making a robust business case, shown on this slide. And what I'm going to do is to talk you through the business case that was made with our assistance to CCG in London, in South London, and I'm very happy subsequent to this webinar to give you further information on that if you'd like to have it, and they've given permission for us to circulate that information. So I'll give you contact details at the end of the presentation, and by all means get in touch. But these are what we think are the key elements you will need to consider in putting the business case together. I think that it's very important to set out the policy support that there is for self-management and self-management programs, and Bev has alluded to that earlier. The House of Care, which is a very well accepted model these days to show how self-management support links into that whole concept. And I think also making sure that what the policy is shown to support the concept. I mean, you know, Bev mentioned the 5-year forward view earlier on, and I was at a meeting at National Voices, the Coalition of Health and Social Care Charities, just before Christmas, where Simon Stevens gave a presentation and answered questions on the 5-year forward view. And certainly what's in there does support the whole self-management concept, which is very welcome. I think the other thing that needs to be built into the business case is that there is evidence out there. Now, there's a lot of question marks about evidence, and is it enough, and is it sufficient, all that sort of stuff. But there is very strong evidence out there, and I think whilst there's always a need for more evidence, what we need to do is to make sure that the evidence that is there is recognised and is used. And indeed, at the end of that session with National Voices, I did present to Simon Stevens some documents which demonstrated the evidence that does exist out there. Clearly, we need more, but there is a substantial body of evidence out there that we need to make sure is in any business case that commissioners put for investment. I think the other thing is to make sure you choose an experienced provider. Now, these quotes here are not mine. They come from the Bromley business case. They've looked at all of the available providers, and very happily said that we were their preferred provider based on the research that they've done. Clearly, there are other good providers out there as well, but we think it's very important in the business case to actually demonstrate that you've got a properly qualified and experienced provider that's actually going to deliver the programs for you. I think the next issue is outcomes, and these have got to be very much tailored to the individual CCG or commissioner area in terms of what is required, what is needed to be achieved. In this case, these are the outcomes that this particular CCG was looking for from putting the programs in place, and you'll see that one of the key outcomes that they were looking for from self-management programs is the way in which self-management programs could help reduce crisis and unplanned activity, and that was the really key driving force. But it may vary area by area. It's very important, though, to have these outcomes defined, and to outline along with that what are the key challenges in any particular area. For this particular CCG, it's very much about a growing ageing population, and therefore a consequent increase in people with long-term conditions. And as you can see there, they've got quite significant percentages of people with long-term health conditions that need to be addressed. And I think that the next thing, and this is where hopefully our model can come into play, because we can adapt it for each individual CCG, is actually to highlight what the costs are of actually commissioning these particular types of interventions and the consequent savings from that. I don't think that's the only issue. It's also really about demonstrating that it's not just a case of financial savings. There's a social value to commissioning self-management programs. Typically, self-management programs are delivered by local volunteers. They have first-hand experience of living with a long-term condition or care for somebody who has. Actually, becoming a tutor on self-management programs gives people very valuable transferable skills, and it also helps to build local peer support and networks for people with long-term conditions. So whilst there are financial savings, and as I mentioned much earlier in the presentation, significant benefits to individuals, there's also a social value and a community benefit as well that needs to be recognised. So I think the other issue, and this is typical of business cases in many situations, is to actually look at the alternative options of, for example, in this particular case, doing nothing, and that was not considered to be a viable option in this particular instance. And maybe in this case they were looking at just commissioning self-management support for health and social care professionals to build on their existing support. But the feeling was that this option really didn't deliver the support to patients and carers as well that was required. So in this particular case, the options were weighed against each other, and the option that was decided upon was commissioning self-management programs for patients, also for carers, and indeed for healthcare professionals as well, so that healthcare professionals were equipped to deal with patients who were much more activated and able to manage their own conditions, and also to give support for carers of people with long-term health conditions. Those options will vary, obviously, according to local needs and what's already available out there, but it is important to do an option analysis. thank you all very much for listening. We've covered a lot of ground today, and I'd like to thank you very sincerely for taking part.